You're currently tuned into Health Professional Radio, and I'm Henry Acosta reporting to you. Our guest today is Michelle Robbins. Michelle is a nurse practitioner and a credentialed diabetes educator at Northern Health. She is also a speaker at the Australian and New Zealand Forum for Injection Technique and Therapy event. Given that it's going to be Diabetes Awareness Week starting July 9 all the way to the 15th of July, we're going to talk about diabetes and what we should know and we should do about it. So with all that said, welcome to the show, Michelle. Thank you for your time.
Thank you. Thank you for the opportunity.
And so to kick things off, I just wanted to know, since you're a nurse practitioner, how did you get started with becoming a diabetes educator?
Well, that happened more than 25 years ago. I had an interest in diabetes, and back in 1992, did the appropriate postgraduate certificate and have been lucky to work in diabetes now since early 1993.
And can you tell us, can you tell our audience a brief summary of what diabetes is?
Well, there are many different types of diabetes, but essentially it's either an absence of producing insulin, which is type 1 diabetes, or an inefficiency in the way insulin works, and that is type 2 diabetes or gestational diabetes. And then there are some other less common forms of diabetes that might be due to medications, for example, or other health conditions. So it's particularly in type 2 diabetes, it's the fastest growing chronic condition in Australia and in the world.
Are there different ways with regards to treating the different types of diabetes, or maybe there's a common way?
I missed that question. In terms of?
In terms of, let's say I have type 1 diabetes, is it going to be different with how I treat it with other people who have type 2?
So there is some overlap, but there's certainly a lot of differences in the way we would treat someone with type 1 diabetes compared to type 2 diabetes, or if they were pregnant, for example. So it is very much individualised. It might be due to the person's age, their occupation, for example, whether they have other medical conditions, whether they've got any of the complications of diabetes. So it's not a one-size-fits-all approach, and it often requires quite a large group or team members to support the person with diabetes. You're going to speak at the ANZ FITTER event. So can you tell us a little bit more about that and what you're going to talk about? So that was an event that we had in May. A lot of health professionals in diabetes, both in Australia and New Zealand, were invited, and these were key clinical leaders to try and drive change. So it was about being able to present the new information, the new evidence around injection technique and ways to improve injection technique in both the efficiency of delivering insulin, but also in terms of the psychosocial issues for the person who's actually injecting insulin.
I see. And what are the ways since you went to the event, what are the new ideas or the ways that can help improve the treatment?
Well, it's important that when someone is injecting insulin, and we also have other injectables now in type 2 diabetes that aren't insulin, that the person is injecting into the right tissue space. So there are certain areas that they should be injecting in and certain areas they should be avoiding, that they're using the right length of needle, that they're preparing the device properly, and that when they do inject, that they're keeping the device in place for long enough to receive the full amount, that the timing that they're giving that medicine is important in getting the best out of it, and also an understanding of not injecting in exactly the same spot every time and not reusing their needles either. So all of these things sound very basic, but it's amazing how over the years health professionals haven't always looked at this sort of dull, boring stuff. They've looked at sort of, the more bright, shiny, new things around without actually remembering the basics of how to deliver insulin and the correct ways of doing it.
Yeah, what are the most common ways that we usually inject insulin to our bodies?
So the majority of people are using insulin pens, which are usually disposable, though some people are using non-disposable pens, and that could be because those non-disposable pens can dial up very small doses of insulin, or they might have an electronic memory to remind the person when they last gave insulin and what that dose was. Increasingly in type 1 diabetes, particularly for children, we're using the insulin pumps now, where someone is actually wearing an injectable device all of the time that's delivering insulin. And that requires quite a lot of additional education and training to be able to use that. That device is not measuring blood glucose levels at this stage, it's just delivering insulin. And that's becoming increasingly an option for children and people with type 1 diabetes.
Yeah, and with regards to the types of diabetes, I'm not very well informed about it. So with type 1, people are usually born with it, and with type 2, do people just get it, or how does it happen?
So interestingly, only 10% of people with type 1 diabetes actually have a direct family member with type 1, so 90% of people who develop it, and that can be at any age, from the age of 6 months to 90 years of age. And we're increasingly seeing older people develop this. It's an autoimmune response. So it's where the body has decided that the cells that produce insulin in the pancreas are foreign, and the body produces antibodies and destroys that part of the pancreas. So if the person does not give themselves insulin as treatment of type 1 diabetes, they actually won't live. So it's a very important part of treatment. Type 2 diabetes was traditionally something that we used to see in older people. Again, people are still making insulin, but it's not working efficiently. Essentially, mostly now due to being overweight, and that's that central obesity around the tummy. But it also can happen in older people or less mobile people, people with disabilities, people with depression, even people working night shift are at a higher rate. And we're also seeing much higher rates in different ethnic communities, particularly with migration and then different lifestyles where people are living now here in Australia. So, but we're seeing younger people now develop type 2 diabetes. So sadly, particularly with our Indigenous population, we're now starting to see teenagers and children develop type 2 diabetes. And so it's, I guess the traditional age groups are changing and blending between type 1 and type 2, that older people are starting to develop type 1 more often and younger people are developing type 2. So it's sort of muddying the waters a little bit and often is confusing for people.
Yeah, I can totally see how that is confusing. Yeah, do you have any recommendations with regards to people who may get type 2 diabetes? What kind of lifestyle changes do people have to make, or what's the ideal way to, do you have a certain diet that you're supposed to have?
Yeah, so it is important to see a dietitian and to have a diet that is tailor-made because healthy eating, and we prefer to use that terminology because it's more positive, and daily activity rather than exercise, because exercise has sort of a negative connotation. So healthy eating and daily activity are the cornerstones to try and make that difference. And for people who are overweight, if we're able to get weight loss quite soon, and now it's suggestive of maybe even a 10% weight loss, we can certainly, possibly even reverse type 2 diabetes, or certainly delay it getting worse over time. So the more we find out about diabetes, the more we realise we don't know, and things are changing. What isn't advisable is just to try and put your head in the sand and pretend you don't have it and not want to have it. It's far better to say, well, I've got it, I possibly need to make some changes in terms of what I eat, how active I am. Medication is not saying that you're failing, so We've got many newer medicines now that not only have benefits for blood glucose levels, but also these same diabetes medicines have benefits for weight loss, blood pressure control, even the risk of having heart attacks or kidney problems. So we're looking at medicines in a very, very different way. And some people with type 2 diabetes will also need insulin. And again, that's not failure. It's just that if that's what they need to keep things well controlled, to keep them healthy, to keep them out of hospital, then having an injectable medicine is also, not a negative thing either.
What's the most common misconception that people have about diabetes? That
being a sweet tooth might cause diabetes. That's essentially, certainly not the case for type 1 diabetes. And unless you're talking about someone drinking lots of Coca-Cola, it's probably not true in type 2 diabetes. So type 2 diabetes is quite complicated. There's many different things that can contribute towards getting type 2 diabetes. Even some medical conditions like polycystic ovarian syndrome will markedly increase the risk. If you've had gestational diabetes, so diabetes in pregnancy, up to 50% of women are developing type 2 diabetes 10 years after that. So there are many different contributing factors towards type 2 diabetes, and it's not so clear-cut. It's quite complex in some ways, so having, simplistic ways of treating that diabetes is not always so useful. And judging someone on how many tablets they take or whether they're injecting diabetes medicine to manage their type 2 diabetes is not useful either. The diabetes is either at an optimal level and well controlled, or it's not. So how you manage that diabetes, how many medicines you may or may not be prescribed is not a way of judging how the diabetes is going. And for many people I see, they're often working very, very hard at managing their diabetes, but they may be on the wrong medicines, or in the case of having an injectable medicine, they may not be doing it properly, or they may not be injecting it in the right area or using the right needles, that sort of thing. So those sorts of things are really important. And by seeing a diabetes educator, it allows that opportunity for this sort of very detailed assessment to occur, so that the person who's taking different medicines is making sure that they're on the right medicines and the right dose, and that they're giving it in the right way as well. And
for all our listeners right now, what would you want them to take away from this interview?
Look, there are many ways of being able to see diabetes health professionals, and diabetes health professionals could be a diabetes doctor, an endocrinologist, it could be a diabetes educator, a dietitian, but it's also important that people see their podiatrist for foot checks, their optometrist or ophthalmologist for eye checks, but they may also need to see an exercise physiologist. They might need to see a physiotherapist. The local pharmacist, community pharmacist can be an integral part of that. And it might also, people like a social worker or psychologist might be also very, very important. So the diabetes team can be quite large, and it's really talking with your general practitioner on building that team. And the general practitioner can use a variety of different tools and programs where you can access maybe a local community health centre or even a private practitioner at no or minimum cost as well. So it's important that you're not trying to do it all by yourself, that there are a variety of people that can support you. And as diabetes changes, and it will change over time, it's at different points of that journey that you might need to bring in other diabetes team members to give you that type of support and information and education.
Yeah, and for our last question, so to all our interested listeners who want to know more about diabetes and maybe even get in touch with you, what's the best way to do that?
There's two ways that might make it easier, and the Australian Diabetes Educators Association and the National Diabetes Services Scheme both have a search engine on their websites where you can put in your postcode to look for a diabetes educator, and they will then give you a list of who is around it with those postcodes or those regions as well. But I would also speak with the GP, your pharmacist. They're often very good at knowing who's around, so that it's useful to be in touch with someone from a diabetes team at regular intervals, because diabetes does change over time. You may need to go on to an injectable, or you might have been taking an injectable medicine for some time, and it's good to have that reviewed and have your technique reviewed as well. And there's often new medicines coming onto the market, so there may be new things or new studies available that you could become part of. So it's not just having education once and never going back and having things repeated over time.
All right. Well, that's all our questions for today, and thank you so much for coming on the show.
Thank you for the opportunity. It's been fantastic.
And that was Michelle Robbins, a nurse practitioner and a diabetes educator at Northern Health. We just finished talking about diabetes since it's going to be Diabetes Awareness Week. And yeah, if you missed this interview and want to listen to it again, or even learn more about medical research, fitness, and current news in the health industry, you can visit us at www.hpr.fm. You can also find us on SoundCloud and iTunes. You can also like us on all major social media platforms. I'm Henry Acosta, reporting to you for Health Professional Radio.